Hello, this is Dr. Emily Rule, physical therapist here. I just wanted to talk really quickly about what the heck direct access is. You may or may not have heard the term direct access for physical therapy. Basically what it is now with direct access, you can see a physical therapist without needing a referral from a physician. Previously, you had to go to a physician, get a referral, and then call the physical therapist and set up an evaluation with them. Now you can go straight to the physical therapist with some exceptions. So there's two main benefits to this direct access. The biggest one is going to be time. It's going to be able to cut down the time from when you get injured to when you can see the physical therapist. So before, when you had to go see the orthopedic doctor or your primary care doctor, usually it would take a week or two for you to be able to get in before you could actually have an appointment for them to write you the prescription. And a lot of times you would go to the appointment, they would do a very, very brief examination, and then they would just say, I'm going to write you a prescription, go to a physical therapist, I want you to come back if it doesn't get better. So it will cut down on that time if you can just go straight to the therapist. That also is important because the sooner we can start to treat a injury, the quicker the recovery time is going to be. The longer or more chronic a condition, the longer it runs on, the longer it takes to rehabilitate from it. It will also help save a little bit of money because it's going to cut down on that doctor's visit. You're not going to have to pay a copay just to be able to get a prescription from a doctor. You can go straight to the physical therapist. Obviously, if you need to see the doctor, the physical therapist can refer you back. But if you're only going to get a prescription, it'll save that money. So in California, their direct access law says that you can either see a therapist for 45 days or 12 treatment sessions, whichever comes first. And typically, if you're not seeing progress in those 45 days, we would send you back to the physician anyways for an appointment. This varies state by state, so you want to check your state laws. And another thing to keep in mind is some insurances won't cover physical therapy unless you have a physician's referral. So that's another thing you want to check up on. If you have any questions or you want help finding either out your state's laws or whether or not your insurance will cover that, please send me a message. I would be more than happy to help.